Prominent R wave in V1 may be seen in A. Anterior wall myocardial infarction, B. Inferior wall myocardial infarction, C. Posterior wall myocardial infarction, D. Left bundle branch block. Correct answer C. Posterior wall myocardial infarction. Tall R wave in V1 in posterior wall myocardial infarction is the mirror image of a deep Q wave in posterior leads. Anterior wall infarction shows Q waves in V1 and so does left bundle branch block. Inferior wall infarction does not produce tall R waves in V1 unless it is associated with posterior wall infarction. Other causes of tall R waves in V1 are right ventricular hypertrophy, right bundle branch block, R prime wave, and WPW syndrome with left-sided accessory pathway. Tachycardia is harmful in mitral stenosis because A. Shortening of diastole, B. Increase in transmitral gradient, C. Increase in pulmonary venous pressure, D. All of the above. Correct answer D. All of the above. When the heart rate increases, diastolic period shortens. In mitral stenosis, when diastole shortens, the time for left atrial emptying decreases and consequently there is an increase in transmitral gradient and pulmonary venous pressure as well as left atrial pressure. This is one reason for precipitation of pulmonary edema in situations causing tachycardia in a person with severe mitral stenosis. For the same reason, beta blockers are useful in mitral stenosis by lowering the rise in heart rate with exertion and other stress. Which of the following agent is not used for pharmacological stress test? A. Dobutamine, B. Adenosine, C. Dipyridamole, D. Metoprolol. Correct answer D. Metoprolol. Dobutamine increases the inotropic state and precipitates ischemia. It is the usual drug used for dobutamine stress echocardiography. Adenosine and dipyridamole are coronary vasodilators useful in pharmacological stress testing and both act in a similar way. Dipyridamole dilates normal vessels and steals blood away from the ischemic territory, coronary steal. Metoprolol is a beta blocker and is used to reverse the effects of dobutamine if the patient becomes too symptomatic on dobutamine. The most common adverse event after an implantable cardioverter defibrillator implantation is A. Pericardial effusion, B. Generator pocket hematoma, C. Lead insulation failure, D. Inappropriate defibrillator discharge. Correct answer D. Inappropriate defibrillator discharge. Implantable cardioverter defibrillators are life-saving devices used for treatment of life-threatening ventricular arrhythmias and averting sudden cardiac death. Some of the rare adverse events which can occur with ICDs are as follows. 1. Pericardial effusion, 2. Generator pocket hematoma, 3. Lead problems like insulation failure and fracture requiring lead revision, 4. Infection, device pocket erosion, 5. Inappropriate defibrillator discharge, which could be due to T-wave oversensing, lead problems or supraventricular arrhythmias. Some may develop psychological problems due to undue fear for shocks. Biomarker for patient presenting 7 days after chest pain. A. Myoglobin, B. CK, C. CKMB, D. Troponin I, E. Myeloperoxidase. Correct answer D. Troponin I. Troponin I level peaks at about 24 hours and remain elevated for about 2 weeks. Myoglobin is the earliest to rise after myocardial infarction but lacks sensitivity due to the interference from skeletal muscle sources. CKMB is specific, rises at about 24 hours but returns to basal level in a few days earlier than troponin I. Best biomarker for myocardial necrosis in renal failure is A. Troponin I, B. Troponin T, C. CK, D. CKMB, E. Myoglobin. Correct answer A. Troponin I. Troponin I is more specific for myocardial necrosis in renal failure because troponin T may be even otherwise elevated in renal failure. Maternal risk factors increasing the risk of congenital heart disease. A. Maternal age 40 or above, B. Multiple pregnancy, C. Systemic connective tissue disease, D. All of the above. Correct answer D. All of the above. Maternal age 40 or above, multiple pregnancy, and maternal connective tissue disease are risk factors for congenital disease in the offspring. False statement about U index. A. Radial tissue Doppler dyssynchrony. B. Standard deviation of time to peak systolic velocities from the onset of QRS complex. C. A value of 32 or more milliseconds is considered to be significant dyssynchrony. D. Can be used to assess the possibility of improvement with cardiac resynchronization therapy in heart failure. Correct answer A. Radial tissue Doppler dyssynchrony. U index is a measure of longitudinal tissue Doppler dyssynchrony. Cob-web sign on cardiac CT scan is seen in A. Aortic regurgitation, B. Aortoarteritis, C. Aortic dissection, D. Aortic stenosis. Correct answer C. Aortic dissection. Cob-web sign in aortic dissection are slender linear areas of low attenuation seen occasionally in the false lumen in contrast enhanced computed tomographic scans.
Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.